Welcome. I am Dr.V.Daniel. Today we are talking about Ebola. It is one of the germs that people have ever faked. A lot of people are scared of Ebola. It is not that hard to understand if you look at the facts. We will find out what Ebola is. We will see how it spreads from person to person. We will learn why it is so bad. Importantly, we will discuss how we can stop it. Ebola is a deal, but knowing more about it makes it less scary. Understanding Ebola helps us know what to do instead of being afraid of it. Ebola first appeared in 1976, at the time in two places, Zaire, which is now called the Democratic Republic of Congo, and Sudan. The time Ebola happened in Zaire, it made 318 people sick, and 88% of them died. The name Ebola comes from a river in Zaire. This name was chosen because it is where the disease was first found, and it is a way to respect the people who got sick. For a time, Ebola would show up every now and then in Central Africa. Then something big happened in 2014. Ebola started spreading in Guinea. It became a huge problem that affected Guinea, Liberia, and Sierra Leone. 11,000 people died in these three countries. This showed us that Ebola is a problem that affects the whole world. The Ebola virus is a type of virus that is made up of a strand of RNA. The Ebola virus particle is pretty big. It is 800 nanometers to 2 micrometers in size. The Ebola virus has 19,000 tiny units of genetic material inside it. The outer layer of the Ebola virus is made up of a type of fat that it takes from the cells of the person who is infected. On the outside of the Ebola virus, there are proteins that stick out. These proteins are like keys that the Ebola virus uses to get into cells. Underneath the layer, there is another layer that helps keep the Ebola virus shaped right. At the center of the Ebola virus, there is the genetic material that makes the Ebola virus work. The Ebola virus has 7 proteins that do different jobs to help it reproduce and take over the cells of the person who is infected. Infection starts when viral proteins attach to cell surface receptors like TM proteins. The cell then engulfs the virus through a process called endocytosis. Inside this part of the cell, the viral and cell membranes fuse, releasing the viral core into the cell's cytoplasm. The viral polymerase becomes active, makes 7 messenger RNAs. The host cell's ribosomes then translate these into proteins. Some of these proteins help form virus particles, while others interfere with the host's defense systems. One protein, VP35, blocks the production of a chemical that helps fight infection. Another protein, VP40, stops the host system from sending signals. The made viral material and proteins come together at the cell membrane. The virus then buds out, wrapping itself in the host's membrane and releasing new virus particles. This whole process of replication takes around 8 to 10 hours. The virus releases thousands of virions. Ebola kills by damaging the body in 2 ways: the virus itself and the immune system's overreaction. The infection likely starts through cuts or mucous membranes. The virus first multiplies in immune cells and then spreads to organs like the liver, spleen, and kidneys. By day 3, the virus is in the bloodstream. This is when symptoms start: fever, muscle pain, headache, and weakness. The immune system overreacts, releasing cytokines which causes inflammation and damage to blood vessels. The virus directly infects. The liver gets heavily damaged, the kidneys do not work properly, the blood's ability to clot also gets messed up, leading to both clotting and bleeding. In the weeks, some patients who survive face another round of viral replication and organ failure. Critical: Ebola is not spread through the air. It does not get transmitted through breathing or casual touch. Tamsing Ebola spreads when you come into contact with the blood or body fluids of someone who is infected. It can also spread if you touch surfaces that have come into contact with these fluids. The Ebola virus is found in the blood, saliva, sweat, vomit, and diarrhea of a person. In the African outbreak, people got infected when healthcare workers were exposed to the virus without proper gear. Family members also got infected when taking care of their loved ones. Some people got infected during funeral practices. We still don't fully know where the virus comes from. Fruit bats are likely to be involved. Other animals can also help spread the virus when people hunt and prepare them for food. Understanding that Ebola spreads through contact is key. When we isolate people and use proper protective gear, we can effectively stop the spread of the virus. The time it takes for symptoms to show up after getting infected, from getting exposed to having the symptoms. Is usually between 8 to 10 days, but can be anywhere from 2 to 21 days. Some people get really sick away with a high fever of over 38.3 degrees Celsius, severe muscle and joint pain, feeling extremely tired, and a headache. Patients often say they feel pain behind their eyes. These symptoms can look like malaria, dengue, or flu, which makes it hard to tell what's really going on. As time goes on, around day 5 to 7, people start to feel even worse. They might get vomit and have diarrhea, and get a rash on their trunk that spreads outwards. Some people see red spots from bleeding under their skin. In some cases, people experience bleeding. When the disease gets really bad, patients get low blood pressure and become confused because of multiple organ failure and have severe blood clotting problems. The lab results show some changes: very high liver enzymes, low platelet counts, and low white blood cell counts. The Ebola virus death rate, depending on the strain. For example, Sudan Ebola virus has a death rate of 40 to 50%. Zaire Ebola virus has a death rate of 40 to 90%, and Bundibugyo has a death rate of around 25%. There is no cure.
Survival depends on care. The key to treatment is giving patients lots of fluids. They lose a lot through vomiting, diarrhea, and leaky blood vessels.
Dealing with infections is vital. Using antibiotics to treat infections that are identified helps people survive.
Keeping blood flowing and organs working is crucial. Managing blood clotting problems requires monitoring and sometimes giving blood products.
Recently, some new treatments using antibodies have shown promise. These antibodies, made in labs, attach to the virus and help the immune system get rid of it. Giving them early help people survive in studies. There are also medicines that would target the virus and are being developed. Good care makes a difference in survival. The difference in death rates
Between care and minimal care is huge. Quality care helps patients survive. Getting care can really help. Supportive care is essential.
The key to stopping the Ebola spread is finding out about it quickly through watching people and testing them in a laboratory. When someone is confirmed to have Ebola, they need to be kept from others in special rooms that have negative air pressure.
The people taking care of them need to wear the right protective gear. This is really important. Finding out who the sick person
that was in contact with helps to stop the spread of Ebola. When someone with Ebola dies, they need to be buried in a way to prevent the spread of the disease, but we also need to respect the customs of the people who are grieving.
Ebola vaccines have been a game changer. One vaccine, called RVSV-ZEBOV, is 97% effective after just one shot.
There are vaccines like Ad26.ZEBOV and MVA-ZEBOV that need 2 shots, and they work really well too. Ebola vaccines are crucial for stopping outbreaks of the disease from happening in the future. These Ebola vaccines are very important for preventing the spread of Ebola. The Ebola virus disease is a thing, but it is not something we do not understand. The Ebola virus disease spreads in ways
it causes sickness in patterns that we have seen before, and we have treatments and ways to prevent it that we are getting better at all the time.
The biggest outbreak of the Ebola virus disease was in West Africa from 2014 to 2016. This showed us that the Ebola virus disease can spread quickly in situations, and it showed us that the people who work on global health can do a great job of responding to a big problem.
People are still doing research on vaccines, medicines that fight viruses, and special antibodies that can help fight the Ebola virus disease.
It is also very important that we make the systems that watch for sickness and the buildings that help people who are sick stronger all around the world. The Ebola virus disease outbreak from 2014 to 2016 happened because of things like the way people live, the economy, and the way society is set up. We can change these things. The Ebola virus disease has taught us a lot about how to be ready for a sickness that spreads to a lot of people. If we understand the Ebola virus disease and we use science and public health systems and work together globally,
then we will be able to respond to the Ebola virus disease. We will be ready for any new sickness that might come up in the future.
If you found this information helpful, please hit subscribe button, like, and share this video. Thank you.